A VBAC or a vaginal birth after cesarean is when you give birth vaginally after having had a previous cesarean section or C-section. Many women choose to attempt a VBAC to avoid the risks of another major surgery and to have a more natural birth experience. However, a VBAC comes with certain considerations and risks that must be carefully evaluated by your healthcare team. So why might you want to have a VBAC? The first reason is that you might want to try for a vaginal birth. Some women prefer a vaginal birth for personal, emotional, or cultural reasons. You might also want to avoid surgery. So a vaginal birth has a quicker recovery time compared to a C-section, which is a major surgery that requires longer healing time. Avoiding a C-section also reduces the risk of surgical complications such as infections, blood loss, or complications from anesthesia. As well, multiple C-sections increase the risk of placental issues in future pregnancies, so you may opt for a VBAC to minimise these risks. Let's go through the pros of having a VBAC. The first is that recovery time is usually quicker with a vaginal birth, allowing you to return to your normal activities faster. You'll also be lowering the risk of surgical complications. Avoiding major abdominal surgery reduces the risk of infection, blood clots, and injury to your organs. You'll have less post-operative pain. Vaginal births usually result in less pain and discomfort after delivery compared to a C-section. There is also the option for more immediate bonding with your baby. With a vaginal birth, you are often able to hold and bond with your baby sooner than after a C-section. There is a reduced risk in future pregnancies, so a successful VBAC can reduce the risk of complications in future pregnancies compared to having multiple C-sections, which can increase the risks of placental issues. Let's go through now the cons of having a VBAC. Firstly, there is a risk of uterine rupture. This is where the scar from the previous C-section tears during labour, which can be life-threatening for both you and your baby. However, the risk is low. You may end up needing an emergency C-section if your labour does not progress well or complications arise. Importantly, not all women are eligible for a VBAC, especially if you have had multiple C-sections, certain types of uterine incisions, or other health concerns. And finally, in some cases, a planned VBAC might not progress as hoped, and an emergency C-section might still be needed, which may carry more risks than a scheduled C-section. So how easy is it to have a VBAC after a C-section? The success of a VBAC depends on several factors. Firstly, the type of uterine incision you had. If you had a low transverse horizontal incision, you will be a better candidate for a VBAC because the risk of uterine rupture is lower. A vertical or classic incision makes a VBAC riskier. It will also depend on the reason why you had the first C-section. If the previous C-section was due to a one-time issue, such as a breech baby, the chances of a successful VBAC are higher. If it was due to a problem that could occur again, like your labour not progressing, the chance may be lower. Your overall health is also a factor. If you are in good health with no complications in your current pregnancy, then you are more likely to have a successful VBAC. It will also depend on the number of previous C-sections you have had. A VBAC is generally more successful after one C-section. Multiple previous C-sections increase the risk of complications and make a VBAC less likely. And finally, it will depend on the progression of your labour. A spontaneous labour or a labour that begins naturally generally leads to a better outcome than an induced labour when you're trying to have a VBAC. Let's go through the VBAC success rate. So the success rate for a VBAC is around 60 to 80% depending on the individual factors that we've just gone through. Most women are good candidates and they can have a successful VBAC. So who might not be a good candidate for a VBAC? Women who had a vertical incision, so a classical C-section, women who have had multiple previous C-sections, and women with medical conditions or pregnancy complications that make your vaginal birth dangerous. As well, women whose labour needs to be induced with certain medications are not good candidates, as these can increase the risk of uterine ruptures. So, to summarise, a VBAC can be a safe and beneficial option for many women who want to avoid the risks and recovery of another C-section. It allows for a vaginal birth experience, quicker recovery and fewer complications in future pregnancies. However, it's important to work closely with your healthcare provider to assess your personal risk factors and ensure that you and your baby stay safe during labour. If you want to attempt a VBAC, you should ideally deliver in a hospital equipped to handle emergencies in case an emergency C-section becomes necessary.